stars understand what black is. It's not a color, it's the basis of all colors. It is not a complexion, it is a reflection of all complexions called human. And out of this blackness, passion flows like a river. Feelings tell the truth. Song and dance and making you laugh are family members. Understand what black is.
You're listening to the Tom Ficklin Show on WNHH LP 103.5 FM, your home for community radio.
Good morning, everybody, and good morning, Harry. I always like to kind of hear your voice. You give me some inspiration. That voice is from Harry, our station manager at WNHH, and I 103.5 FM. And it's really important, I think, for us to just consider the fact that there are, let's say, a number of radio stations throughout the globe, but we have one of the best. I mean, I wouldn't be on it if I wouldn't be on it, and I wouldn't say it if I didn't believe it. And I say one of the best because it is. And if you want to challenge me, I openly ask you to email me at tomficklin@aol.com and email me your favorite radio station. And I say one of the best because when you think of community radio and variety and diversity and inclusion and topic dissemination, check out the schedule for WNHH 103.5 FM that you can listen to worldwide. And I challenge you again in terms of look at each of the program topics and decide for yourself whether there's something there for you, and even something there for your enemies. And I think that's the key to our collective survival, to understand who our friends, our not so friends, people that might be opposed to our positions, but also for WNHH 103.5 FM. It gives you a chance to understand people's perspectives. We really got to take, I think, the deep dive to, if we disagree, to disagree agreeably and hear what people have to say. So good morning, everybody. Good morning, Let's see, we have Millie and Glenda, how you doing? And Robin and Bernard will be joined by a few other people. The topic of the show today is something that's really important to me. Community health workers in the Vanguard. That's the topic, community health workers in the Vanguard. And this is not to disparage researchers and doctors and physicians and therapists and psychologists and the whole medical profession. But it seems to me that the one-to-one looking a person in the eye, being in direct contact with them, in terms of really being concerned about their survival and their thrival. And the community health workers kind of fit into that description. But I'm open to McGlinda and Millie and Robin disagreeing with me. We have about, and even Bernard, we may give you a chance to say a few words, Bernard. We have about 55 minutes, and there's no pressure in terms of the show today. Really just want to talk about your purpose, your passion, why you've even decided to be a community health worker, your title and role if you want to. And it's not in terms of the title and your being so important, but what does the title mean to you? What does that title mean to you? So you can start with who your grandfather is, your grandmother is, your mother, your father, where you were born, or you could just jump in with your current position. But I want people to kind of just take a deep breath and enjoy these next 53 minutes about community health workers on the Vanguard and this pandemic, this epidemic, this issue of why we can't all get along and save one another and not be complicit to a murder, literally not be complicit to a murder. But that's so enough of my soapbox. I'll get off my soapbox. Bernard, good morning.
Good morning.
McGlinda, good morning. Robin, good morning.
Morning. Can you hear me okay?
Coming loud and clear, McGlinda.
Can you hear me okay? Okay, good.
Millie, let's do a sound check on you. Good morning. And Robin, let's hear your voice.
Good morning.
Good. So everybody's coming in. Bernard?
Good morning.
Good.
Hey.
And I want to thank Bernard just before we get started, everybody, for kind of organizing this and as a Fight the Flu coordinator, to have people on the team that can kind of all pull up the oar, can all kind of participate, can kind of share in the struggle and the joy. That's such a joy. So Bernard, I want to personally thank you again for making this happen. Millie, would you like to go first? Millie?
Good morning. Yes, good morning.
Good morning. So share a little bit about who you are.
Yes.
Let me just say that time goes quickly. So if everybody doesn't get a chance to say everything that they have on their heart and mind and soul, do not worry. Do not worry. I've already committed to doing another show. I've already committed to doing another show. So everybody will be invited back. But Millie, kick us off and share a little bit and let us know who you are and why you're on this planet at the moment.
Hi, good morning. My name is Millie Landak, and I work as a lead community health worker here at Project Access in New Haven. And I've been an advocate for over 10 years now. I have worked in the community, not just in New Haven, but also in Bridgeport for, like I said, over 10 years. And this is my passion. This is what I love to do. I love helping, and that's who I am. That's why I'm here.
All right. Good. And we'll come back to you. Miglinda, just a few. And I love your first name. Miglinda, what's your middle name?
Kelly.
Okay, that's okay. All right. So,
Last name's Eager. Good morning.
Good morning.
Good morning, everyone. Thank you for having us. My name is Miglinda Eager, and I'm a navigation nurse manager here at Project Access as well. I work with Millie. And I've been a nurse I started my nursing journey almost 20 years ago, working at St. Raphael's campus before I became Yale New Haven Health. And I would say my passion for wanting to know more about, healthcare and how it impacts Brown and Black people happened about 20 years ago. Just seeing patients coming in the hospital and just wondering, what happens when they get here, what's going on outside of the hospital, what's going on in the community, how did they get here? So all these questions, kind of came to me, and I went, continued on to grad school. And after that, started working in long-term care and home care and really meeting the, patients or people where they are. And it really gave me a profound understanding about the struggle of a lot of our community members out there. So in 2015, I joined the Project Access team, and we work, Project Access really, how do I say it? It really is a passion within itself. It was developed by a group of community providers who saw that there was a concern in the community with access to healthcare and inequities and disparities. And so the goal of the Project Access, we're a team of navigators, we're a team of community health workers. So our purpose is to provide those resources to the community, give them access to care that they, for underserved people. So if you don't have insurance, if you have minimum insurance, if you just don't have the connection to a specialist and those resources, that's what we do. And Millie can talk to you more about at some point about what the community health workers do, but we certainly, that's our goal, to give the people of the community what they need, and tailor that message to them.
Excellent. And Robin, just before I come to you, just want to mention that I had the opportunity earlier this week to radio Zoom chat with Darcy Cobbs Lomax, and I say that that this health issue, this is, from my standpoint, this is the front page news. This is the international news. This is the economic news. So I don't mind every show that I've had over the last 2 or 3 years has had some sort of health connection, and that's deliberate and intentional. Robin, please. Good morning. How are you doing, dear?
I'm good.
Good.
Thank you for having me.
I like
Good
your
morning,
background.
everyone.
I like your background there.
Oh, yeah, that's real.
All right.
So I am the marketing and outreach specialist at Cornell Scott Hill Health Center. I've been working with the health center for 8 years. Prior to this position, I was a case manager at Grant Street Partnership. So the passion is connecting with the people. Connecticut is a state that has so many resources. However, resources mean nothing if people don't have access to them or knowledge about them. And that is my passion, to connect the people with those resources so they can actually take advantage of them and they can be a benefit to them.
Excellent, excellent. Bernard, good morning, man. Long time no see.
Hey, been a long time, Tom. Been a long time, a couple of days.
Absolutely. Weigh in a little bit about the Fight the Flu campaign. Might be in some people's mind not as relevant, but we're fighting for the people. You can say flu or COVID or health, but we're fighting for the people. So talk a little bit about Fight the Flu and how it's going to.
With me, a lot of what the team has already said. Cornell Scott was the reason I actually came to Connecticut. I came to Connecticut as a case manager for Cornell Scott in a program that they had established with bringing medical and behavioral health under the same roof. And so through that, I was a case manager in Michigan for the state of Michigan with the Department of Social Services. And for me, I thrive when I see success within the community that I come from, and that's Black and brown people. I thrive when I see us succeed, and I mourn when I see us in a place where we're not succeeding. So my goal is to work, when I came to work as a case manager, was to make a change for those that are within my community that were struggling, to teach them how to actually formulate what success is all about and taste what success is all about. Because people in our community a lot of times don't really know or taste what success is, or what they or get a feel for what success is, because nobody has ever opened those doors. I'm one of those people that want to open doors.
Excellent.
Because somebody opened the door for me. And so the way that I succeed is giving back to the same people that gave to me. So wherever I am, that's my goal. And Cornell Scott was the reason that brought me to Connecticut to actually fulfill that goal. And that's what I do now. So when I joined Southern Connecticut State as a flu fighter, it wasn't necessarily for the flu in itself. I found an opportunity to really engage Black and brown people in a way where we could take advantage of a service that was given to us for free. But I don't want to get caught up in the free, but I want to get caught up in the service, to give us a service that we can utilize to make us a healthier community. Yes, we're angry. Yes, we're frustrated. Yes, people have taken advantage of us. And yes, they still taking advantage of us. But when you get an opportunity to give somebody something that can benefit them at no cost to them, and that's something that is regularly happens in our community, when somebody give us something of value that can really help us. And that's kind of what the flu fighting meant for me. I want to give this community something of value that the CDC gave to us. And again, I can't speak for the reasons why people do what they do and the reason why they decided to give us this money and all of that. We can get caught up in all the politics of that, but that's not necessary. What I want to get caught up in is the fact they gave it to us. The fact is here, and the fact, let's take advantage of it, because I don't know when this goes away at some point if it will return. And so with that said, I want to impart this to this community, that I care enough about you to make sure you know that it's here. Take advantage of it, because again, I don't know why people do what they do, but if they say they care about us and they want us to be a healthier community, then I want to be part of that, because I am a familiar face. Yeah, you might not know my name and you might not know my background, but one thing you do know is that I'm Black. And so with that said, I want to make sure that I impart that and give them this opportunity to be healthier. And I'm gonna formulate what Cornell Scott would call a patient-centered model home philosophy, where I'm gonna formulate that circle and I'm gonna start imparting services to that person that's in the center.
Right. I said, thanks so much. I see Robin nodding. And again, this is Black History Month. I've kind of termed it African Genesis Month, Black to the Future Month. And as we know, every day, every moment, every second is a 24/7, 365 experience where we can be historical change agents. And Robin, I just want to mention that when we mentioned the term Cornell Scott, unfortunately or fortunately, I mean, everybody was not alive when Cornell Scott was alive. But it's important just to kind of make a note that as we had this show on community health workers, that even the establishment of community health centers, that was at that time a revolutionary, innovative, tradition busting approach to establish community health centers. And Cornell Scott here in New Haven, we were one of the first to kind of take ownership of our health. So it's really important, I think, during this month to kind of recognize our pioneers. Millie, before I go around everybody again, let's give a little commercial about how people can access the services. So Millie, in terms of Project Access, what should people know? How can they contact if someone's listening and they might have someone in the hospital or not in the hospital or just friends that need to know about the existence of Project Access? What's the best way for them to get information and to support and kind of become an ally to your initiative?
Well, when it comes to the patient navigation, there's two different groups within Project Access. There are the community health workers, that's the team I lead, and there's also the patient navigation team. And to get into, as Maglinda mentioned, the patient with an urgent clinical need can be referred by their provider to the patient navigation team. When it comes to my area, the patients are screened within a clinical visit. After having a clinical visit, they are screened. And this is a program that was granted to Yale and Project Access with the whole purpose of guiding patients to community resources that can help them with their social needs. And that's where I come in with a team of CHWs. We guide, we're the community health workers that guide patients to those resources to address those social needs.
Excellent. Millie, give me a few examples. Bernard has been on the show for a few times, so he knows I'll try to. Sometimes I might go off the rails, but you're not saying that you're going to guide me to Fort Knox for me to kind of come out with any bullion or bitcoins. But give us an idea of some of the resources that you might be able to open it, as Bernard mentioned, open the doors for people.
Yes, so we guide people to food pantries or help them fill out applications for SNAP benefits. We might help them with, if they have a housing need, how to apply for a Section 8 voucher, how to get transportation to medical appointments. We help them fill out their VEO application. We guide them to utility assistance programs that can help them with the utility needs. If there's concerns with safety, we guide them to Cornell Scott, get your, social, any type of social services that Cornell Scott can provide. We also work in close connection with Fairhaven Clinic. We guide them to that. I don't know if Maglinda, you want to add a little bit more of what the patient navigators
Great.
do and how they get referred to the program?
Before she jumps in there, I just wanted to say Project Access is also a very intricate part of what we do at CARE. I have to give them that shout out too, Tom. I mean,
absolutely.
To promote and get the word out through their patient base. We're fighting the flu, and we look forward to continue working with them as it relates to getting the information out for COVID. So I got to get that great shout out to Project Access for their help in this initiative as well.
Thank you.
Excellent. The more allies, the better. I got a call this morning from the head of the Greater Bridgeport NAACP, and he was interested on whether I could devote some shows to the health issue. So this was just a call out of the blue. And we've done several, 20 or 30 shows on health. So I told him modestly, yes, health is a very important issue to me. But the fact that people are reaching out from Bridgeport and Hartford and Stanford, I think people are understanding this is a movement. This is beyond a movement. I have a word for this. this is a crusade that we're involved with. So, but McLinda, please share a few examples, because it's so important for people to realize that your health is so connected to so many other issues. And I think people don't always realize what's available, as Bernard was mentioning.
Yeah, absolutely. So Project Access, we have a network of providers. So we have the clinics, Cornell Scott, Fairhaven, even private offices. We have it's a group of volunteer providers that are actually out there donating their time and services to help patients who do not have insurance or if they are underserved. So oftentimes we will receive a direct referral. Either a patient will mention to their provider, what about Project Access, or the provider knows that this patient needs urgent services and will refer the patient. Or even in the hospital, there are times, so it's really more of a care coordination kind of network, so that there's no gaps in care. So if you have a patient that goes to the emergency room, I may get a call from the nurse manager or from social services.
Yes.
Same thing at the clinic. So it really is, it really prevents any barriers in care, because our goal is to prevent patients from having to go to the hospital, to the emergency room when it's kind of too late. So we want to get them that access to the specialist before they end up in the emergency room. So it really is a two-way street. A lot of the patients in the greater New Haven area, they do know about Project Access, and they will enlighten the provider about them, or the provider is well connected with us and will, refer patients through us so that we can help getting them their care.
Robin, let me come to you, and feel free to kind of name drop a little bit. I mean, you can mention Mike, you can mention Carla, you can mention Yusef. I'm just saying, I can give you a few examples of names that you can mention. But I think part of the show, the Tom Ficklin show, which I really pride myself on, is people getting to know the inside of an organization, getting to know the people, the structure, names, faces, just so that they don't feel removed from making change. But so have we said anything, Robin, thus far that has stimulated you to say a few words?
Yes, just the word itself, community. That is what the Hill Health Center is about. Our tagline is community of caring. That is something that we've been focused on for the last few years, as far as building those relationships in the community, because that is how the community works. Everyone is lending their helping hand. So we are building relationships with the churches and the people in the community. Is not just health services, although we provide multiple health services, addiction services, mental health services, pediatrics, dental. A lot of people don't know that we do dental, we do women's health, but we also engage in trying to get resources to the community, such as food drives and education. We do internships. We do many things to engage with our people in the community. Our CEO, Mr. Michael Taylor, is a person of color. He is a Black man, so he is very concerned and engaged in our community.
Yes. In fact, Michael was on the show about shortly after he ascended. As you know, he came, I think, in the second position and then kind of moved up. Maybe 2 or 3 years ago, he was on the show, and Carla was in the studio as well. But tell us some more about Cornell Scott, because, and I'll throw this question out with the issue of getting the vaccinations, the first and second shot. Let's kind of go around how you're helping people get the shot, get there, schedule the appointments. I mean, we hear you either call it state, you can call it city, blah, 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 we can call it health department, but we got to get more, we got to touch people's in their heart, mind, and soul more.
We are in the process of building basically more access to it as far as the knowledge, because it's different than the testing. People think you can just set up something and boom, go. It's not. Because of the delicacy of the vaccine, it has to be handled totally different. So it's not like when we went around the cities and did the pop-ups and we could just go and test people at different sites. Although we are looking into starting some mobility from our actual brick and mortar sites. We are looking, starting the week of the 22nd, trying to be use our mobile van to come into the community. That is going to be on a test run basis to see how it works and see all the logistics of that. However, prior to that, we do have our testing Monday through Friday at Columbus in our trailer from 8 a.m. to 4:30. We also have opened up vaccines at the Dixwell site, 226 Dixwell Avenue. On Tuesdays and Thursdays from 9 to 1. Just on Tuesdays and Thursdays for now, but it may be increased. And we're looking into possibly in the next week or two opening up a site in Hamden. So we'll let you know more about that.
And Millie and McGlinda, before I come to you about the COVID testing and COVID vaccinations, Robin, have you seen as many people might know, with the new Q house going up, your 226 location is going to move over to the new Q house. Have you seen the swimming pool over there that you're going to have is going to be in your name, or the sauna that's going to be in your name? Have you seen the diagram of the Robin Moody swimming pool? We haven't seen that yet.
Haven't seen that yet. But you know, soon come. We'll see.
But it's exciting to know with the Q house when it opens up, and you'll have a larger space, obviously.
Yes, and we're looking maybe this summer. It looks to be slated for this summer to open.
Excellent. Millie and McGlinda, in terms of the access to people getting the vaccines, any comments in that regard about how you might be able to contribute to that taking place?
Sure. So currently, with the leadership of our director, Giselle Carlota McDonald, we're working on a navigation vaccine program. So we are all trained to actually schedule patients who need vaccines.
Excellent.
So we can schedule the appointments. So right now, we're just like Robin said, it's just a trial period. We do have someone that's going to start, one of our staff members will start to call to see if they need, assistance with scheduling, because we really want to, access is such a huge issue in the community, and not knowing where, when, how to get there, those are big issues that, we have to address. So we're going to try, hopefully, I think this week or next week, seeing how that works, scheduling them, because we have access to Epic, a medical record within the health system. So we're going to, trial this out. I know that there's an issue with the amount of vaccines that are being distributed and allocated to the community. So, we're also, being very watchful to make sure that we're not, patients aren't showing up to get their vaccine and there's no vaccine. So we're really cautious and really trying to keep up to date with what the health department is saying, and a lot of the leadership is saying about, where the vaccines are coming and going.
Excellent. And actually, that's another reason why I want to do a show in late March or a follow-up show in April, just on this topic, because as Bernard has mentioned, access and utilization and reaching the people, that this last mile is so key. Bernard, I see you shaking your head a little bit or nodding in agreement. But my sense is that there's something germinating in that beautiful mind of yours.
Man, it is. First of all, I just want to throw out there, so anybody that's listening, I want them to hear this from me, of the work that these companies and agencies are doing with this, with the FQHC from Cornell Scott is doing in this community, and these workers that rarely get recognized. Because typically when we talk to people, it's usually our leaders, it's usually our leadership and senior leadership that is on the call. And I want you all to know how important you really are. I've been a caseworker, and I'm still a caseworker in so many ways, and to be able to be recognized for the work that you do is critical to the success of this community. So I recognize you, I applaud you. But when it comes to COVID, the preparation for this is key. And this is why I work so hard, because I don't want our people to miss out because of misunderstandings and myths that has nothing to do with your health. This is somebody want to keep you crippled. This is somebody want to keep you down and keep you in a place where you're unhealthy and they can control you. I'm telling you, this is an opportunity. People, listen to us as we tell you, please, when the vaccines come and they offer this to you and these workers put this information out there for you, please go and get vaccinated. Don't let anyone tell you, don't listen to people tell you that's the devil's work and they trying to kill us. Then they're going to kill the whole planet then, because this is not just Black people that's taking it. We all need to take it. So when this opportunity come for you, please go out and get vaccinated.
Let me say that Bernard speaks for himself and not for the station, not for myself, not for the rest of you. No, I say that because I have a kind of strange sense of humor, which sometimes is not successful. But the passion, I think we all are so passionate about this. We all have and anxious and frustrated and mad, and any other word you want to throw in as well. So these are times where we have to kind of just share our views. Millie, I see. I can't see you in person, but I sense that your brain is kind of germinating some thoughts. Anything you'd like to share?
No, I just wanted to add a little bit that to what McGlinda said, that we are a work in progress. We've never dealt with a pandemic before, right? So we are learning as we're going, and we are connecting with other community resources to help and help those that are most vulnerable. We are helping with trying to connect with resources like Desk, how we're trying to build a workflow and how we're going to help and go in there and help with scheduling the appointments with the people that are most in need. And I agree with Mr. Bernard. We need to have more access, and we need to advocate more, and we need to educate more our community. And I totally agree. We need to all chip in.
And you mentioned, Millie, about not necessarily experimenting, but being creative and innovative. And there's no institution on the planet right now that is not aware, or they should be aware, that this is a whole new day. There's our political system, economic system, Federal Reserve, Apple, you name it, Google, churches, airlines, and everyone is affected. We all have to understand this is a creative opportunity, and hopefully we won't all kill ourselves. So this is the time for us to work on our mental strength, our social cognitive strength, our communication strength, and understanding that this is a global experiment, that we're all, it's a petri dish at the moment, and hopefully we won't be thrown away with the rats. McGlinda, any comments?
No, I totally agree with Millie and Bernard. Access is definitely where we all need to focus in communicating. Building that trust in the community is really crucial. I mean, I know people that do not believe or want to get the vaccine, and there's a lot of reasons embedded, from history, and some people don't believe in, just the idea of getting the vaccine, for social experiments. And but what we have to do is stay focused and provide them with the correct and accurate message, and and really point out the myths, behind what they believe. Talking to people, oh, I just thought it was one shot. No, it's actually 2 shots for certain, certain vaccinations. So really keeping them informed so that they can make an informed decision. That's going to, and I understand that it's scary.
Yes.
It's this whole thing.
Yeah, these are scary times.
Really, even for health professionals or community health workers, Mel and I've had many of conversations just about the hesitancy, and your initial response is hesitancy because you're not sure what it is and where it's going to lead, right? But you if you believe in science, if you believe in leadership, if you want to do something for the greater good, I think that we all have to kind of gather together so that we can make this happen. I mean, I have not seen my parents in over a year because of the pandemic, and they are at an increased risk for, catching the COVID disease. And, you have children that, could be easily, they're spreaders. So, you really want to keep those things in place. So I just think that it's a community effort, in order to achieve this goal that we're all striving for, and respecting other people's opinions at the same time, giving them information that's important.
Yes. Robin? I think you're right.
Yes.
Oh, there you go.
The education is, I think, the most important piece of getting the information to the community, because we as Black people, we have history. We have history of being treated badly, poorly, all types of things. And people are taking that information, bits and pieces, truths and myths, and they're putting it all together, and they're like, no, I'm not gonna subject myself to that. However, there is misinformation, and we want to give the correct education and information so they can make the informed choice for them.
Yes.
And what we really want to communicate is that if we as a people want to get back to some form of normal, we have to want to be able to protect ourselves and all those around us. And the vaccine right now is the way that we can do that.
You're right. And as you mentioned, in addition to still testing, and in addition to still following the safety protocols, et cetera.
Right.
Bernard?
One of our outreach workers by the name of Valerie Lane said something that was key, based on a statement that one of our pastoral leaders comments that he made, which is true. It's a true statement what he said. And he said that, how it's funny how they came up with a vaccine so quickly, and they haven't come up with a vaccine for HIV, and which is true, and he wanted to know, okay, why don't we have a vaccine for HIV? And what Valerie said was key. That's true, sir, and it was a true statement. But she said, what we're dealing with is a pandemic right now that we can't put aside. And you're talking about, based on media, what we hear from the media, how every day thousands of our people are dying. So we have, even though we're scared, because believe me, I was just as scared, and not really understanding, the vaccine in itself, even though I'm on the inside. That doesn't take away me being concerned. But I would rather that I take a chance, with something that may prevent me from catching this very dangerous virus, because I do have other medical conditions that affect most African Americans when it comes to diabetes, and when it comes to asthma, and when it comes to high blood pressure. And this virus attacks those particular places because it's a respiratory virus. So if you can't breathe already from asthma, and you get this virus, your chances are limited. Not to say that you wouldn't survive, but your chances are limited. So you want to do all you can to prevent from finding out, and I don't want to be the one to find out, so you got to begin to place your trust in the right places. And yes, it's scary. It's scary, but it still doesn't mean that you shouldn't take the opportunity, because I remember when when they probably came out with the flu virus over 50 years ago, people were scared to take the virus. They were scared to take the vaccine, and some still are. but somebody took it and they're still here. Like me, 20 years of taking the flu vaccination, 20 years. And I'm just as healthy as I want to be. So we have to take that opportunity to take that chance instead of taking a chance of catching it and not surviving.
Indeed. Millie, I think you guys have caught the paradigm here. It's kind of the circle. Millie, McLinda, Robert. That's the circle. We have about 15 or so minutes, and I know that sometimes radio through Zoom or doing these public, I'll say sincere public testimonies is sometimes uncomfortable, or you're not quite sure what to say. But my show is designed for you to really just speak what's on your heart and mind and soul at the moment. If you want to throw in how that relates to your work, that's fine as well. And I preface it that way in terms of, someone's mentioned mental health, that from my standpoint, if everyone on the planet is, whether they recognize it or want to admit it or not, is in some way on the edge. It's some way on a critical mental health edge of instability. Now, whether you want to phrase it that way or not, but so Millie, without any further ado, any thoughts that we have about 10 minutes to kind of share. It could be your purpose, your passion, your reason for being, your organizational mission, whatever kind of strikes you as what you want to share with the audience.
To those that are listening, the only thing I want to share is the same message that everyone else has. I was hesitant myself. I was very nervous myself about the whole vaccine idea. But I took a chance because I love my kids and I don't want to take a chance at possibly death because I hesitated in taking the vaccine. And little by little, my children are a little, they're grown, but they also joined, they were also afraid and they also came and my youngest son, who happens to also be Black, went and took the vaccine himself. And the hesitation was exactly the same. This hesitation is for all of us, young and old. But if we put our fears aside and get start, like Bernard was mentioning, taking a chance in the right direction, right? Yeah. I think it's a very important message to send out. And thank you.
Excellent. McLinda?
Yes, I agree with Millie. As a nurse, there's a lot of things I know and there's a lot of things that I don't know. You're still, we're still on that learning curve. And, when it came to this virus and the vaccine, I did have to have some conversations with those who understood the anxiety that goes with making a decision, because if you talk to everyone about it, you can, get, a lot of information, which, can really filter, the goal that you want. My goal was to make sure that I'm safe and that my children are safe, right? So that's a lot at stake. I would not want to risk, bringing home the virus to my children and my children vice versa. So I did have to really have a conversation with one or two and then focus on myself and focus on my goals. My goals are to live. My goals are not to transfer this virus to my children and to be here as long as I can. And to also see my parents again, see my brother again, to make those family connections. So once I think it took me about a week or two, and I said, what? I went with a nursing buddy of mine that I've known for years, and we did it together. Sometimes I think you have to do things together. From someone, I think it's encouraging. And like Millie and Bernard said, we're all human. We're here to service people and to provide that information, but we're human. And I think Bernard said at another one on your other show before, what better way in order to give the information, you need to be about living the information, right? So the information that you're giving, you need to be about following through yourself, and you can easily, it's better to reach the people,
Indeed.
you're able to live it out.
Indeed. Robin?
Yes. One of the things that concerns me is we hear a lot of talk from people saying, oh, when is this going to stop? When are we going to get back to normal? And I posed a question to everyone. What are we willing to do to get back to normal? Because it's a trickle down effect. I mean, we are concerned about being able to see each other and things like that, which is very important. However, there's so many other things that are going on that we are also missing out on.
Yes.
We're not going to our dental appointments. We're not going to our women's appointments. We're not going to our eye doctor appointments, our physicals. Our children aren't getting their physicals. It's so many other things that we're not doing or neglecting because of this situation. So normalcy includes everything. So what are we willing to do to get to that normalcy? And right now, the thing that's available is vaccines.
Indeed. We have about 10 minutes. I just want to mention one thing and then give people a chance to talk about maybe some of their last comments. But let's mention some names of people that the other public health workers that aren't on this call. As again, we're going to do another show in late March or April. But Millie and McLinda and Robin, mention some of your coworkers. This is a chance to name drop because it's important for people to know. I mean, you mention names, somebody may say, "Oh, yeah, I know Joe, or I know Jim, or I know Delia." So Millie, give us some of the names of people that are keeping you out of trouble and making you a great leader at Project Access.
You mean a shout out?
Yeah, give a shout out, kind of publicize them, acknowledge them, and just give a shout out. Right?
Yes, I want to give a shout out to my team, my CHW team. There's David Diosa, there's Jane Vasquez, and there's Sarah. Bernard, you're making me laugh. Sarah Sahib, my whole Project Access team, everyone.
Give me some more names, and I say that because it's so important. These names, people may not know you, Millie. They may not know me, but they may know some of the names you just mentioned. So share a few more.
Yeah. Jahaira Alvarado, Jackie, McLinda, help me out.
Okay, McLinda.
Sure, yes, Jackie, Damaris, Joanna, Javitsa, Josh, Wells, Lauren, our director, Giselle, Dr. Marcella Nunes-Smith. I want to give her a shout out.
Yes.
Are we missing anyone? Katia, my goodness, Katia. Katia is my go-to. Katia works with Bernard on some projects.
Yeah.
Nancy, who else?
Jahira,
the whole entire team. We're a team, we're a small team and we do big things. So
yes, you do.
It's and sometimes we feel like we're spread all over the place. So without everyone's support, we could never make this. We couldn't make the strides that we're making right now. So I appreciate all of them.
I agree.
Robin, just before I come to you, you mentioned Giselle, and I believe Giselle, I think she'll allow me to say that she's had her first dose of the vaccine. I think just recently.
Second dose.
Just recently, and so
yes.
She'll be back on. And Giselle had shared with me, and she's not the only one to mention this, that sometimes you do feel some temporary side effects of taking the vaccine, and that gets back to Robin, your point about real information versus disinformation. But again, people's bodies we're same in a number of ways, but sometimes your body does react differently. But Giselle will be on the show. I promise her. That's the reason the only reason we're doing another one, by the way, so she can have the spotlight. Robin, some shout outs to folks at Cornell Scott. Now you guys have about 200 or 300 employees. I forget your exact number.
Well, more than that.
But it's up there, so we don't have time to mention all All of them, but
9,000 of them.
share a few.
I do want to give a shout out to my direct manager, who is Carla Esdell Bragg. She is the director of marketing. She is the driving force behind all the informational things that you see and hear, the videos or radio spots, or even all the signage you may see in the building, anything that's printed. Mm-hmm. She is the driving force behind that, as far as getting the information out, making sure the information is clear, making sure it is reaching and relatable to our communities. So definitely giving a shout out to her and the rest of the marketing team, Kim and Chris and Satch, to our CEO, Michael Taylor. He's the one behind all of this. And to our nurses, our doctors, our MAs, all the frontline people that are dealing with each individual patient on a daily basis. I want to give a shout out to them because it is not easy. It's not easy.
Excellent. And Robin, just share a little bit about some of your actual outreach workers. What are some of their names?
The outreach workers.
Mm-hmm.
So we have actual mobile teams that were working over the summer doing the testing, and we were doing pop-ups in Milford, West Haven, Hamden, New Haven, and Sonia. So all the people from the pop-up teams that help with that, let's see, Frusion, Alyssa, Stacy, just quite a few people.
Yes. Excellent.
Yep.
We have about 3 minutes, everybody, and I really want to thank you now and give you a chance for the last word. But Bernard, you referenced CARE, C-A-R-E, and we don't have time to talk about all of our total staffing. But share a little bit about your relationship and your working so closely with our director, Alicia Santilli.
Oh, wow. Alicia opened up the door for me to be independent and to be able to actually do this work, having a clear mind and a clear heart to kind of allow us to come in and take over and do what the grant expected, but also to do what this community needs. And that's all of us that's on this call. We all have goals and aspirations, but doing it together is what gets the job done. And I'm so happy that we have the opportunity to make this collaboration between Cornell, Scott, and Southern, and Project Access and Southern, and so many others that we wouldn't have time to name. But I'm just very grateful for her bringing me aboard, along with you, Tom. You was part of that team that brought me on. I'm not going to leave you out of that. Tom was part of the crew that brought me in, and I'm just so grateful to all of them for allowing me to do the work that I'm so passionate about. Thank you so very kindly.
Excellent. 30 seconds, everybody. Millie, kind of last words.
I just want to say a shout out to my husband and my children in Bridgeport.
And let me just say, McGlinda and Robin, before I come back to that, Millie, I'm so glad you mentioned that. We forget often about our families. We just forget that should be the reason that you get up in the morning and want to get up the next day.
That's the reason I'm here.
So what's your husband's first name?
Timothy.
So, okay, so all right, Timothy, good. McGlinda, because Harry's going to play the music, so we'll know, but McGlinda.
Mm-hmm. Quick shout out to Solange and Juan. I forgot to add them, but I just encourage us to keep up the good fight.
Excellent. Good fight. Robin?
Oh, I have a very large family. So all my family, for all their love, support, my friends, I love you, and we in this.
Hey,
we're gonna do this together.
We're in it to win it.
Family, so I love all of you.
Yes, we're in it to win it, and just thank you so much, everybody. That's the wrap for today. Again, we're going to come back, so let your fellow co-workers know we'll be back in late March or April to do another show. And I deeply appreciate you.
Thank you.
Take care, everybody.
Thank you so much.
Addition, feeling positions, looking at the void in myself and feeling what's missing. Better watch the way you going, better go in the right direction. In the moment you stressing, but you counting blessings. And I know that for certain. Keep on working, open curtains, haters swerving, cause they ain't ready for your final version. I'm never gonna give up, fall down, I just gotta get up, yeah. Cause this is my road, lights, camera, action, I'm ready to go. I'm never gonna wanna give up, fall down, I just gotta